Hey everyone, it's Dr. Melanie Palm from Art of Skin and Bee. So what do we like to do over our lunch hour? EMFACE. So I want to, if you haven't had the opportunity to meet my two amazing non-invasive body contouring experts, we have on my right Christy Cashman, and right behind me, and it's her last day before maternity leave.
I'll be gone for a couple months.
Ricky Hoppy. They are amazing. Both of them cumulatively have over 2 decades of research and experience, I would say, in non-invasive body contouring. Christy teaches at Cool Sculpting Academy, so she teaches rising stars how to do correct placement of our Cool Sculpting devices. So we're really lucky to have her as one of our newer additions to our staff. And Ricky has been doing body contouring for how many years now?
Probably about 10.
Yeah, so about 10. And I think both of you guys have been featured in some before and after campaigns from various companies, have been involved with research. So we just have amazing people, because half, I think, of the special sauce and getting amazing results is having a good mind and somebody with good technical expertise. So today, over my lunch hour, I'm going to do my 3rd EMFACE treatment. We are one of the few in San Diego to actually have this device. It's the first device that's actually used for non-invasive muscle toning of the face. So we've had EMSculpt and EMSculpt Neo, which we've used for muscle toning on areas like the abdomen and areas like the buttock and the arms, and we're doing thighs, and where else are popular areas you guys are doing now? We've got the edge, so we're doing that for our legs.
Tiny waist.
So now we're translating that to a technology we can actually use on the face. It's called EMFACE, and it's got 2 technologies. We're going to demonstrate it now. Radio frequency, which delivers heat to the skin. We'll kind of explain why that's important. And then HIFES technology, which is high intensity focused electrical stimulation. And that's what you're going to see me actually toning my muscles involuntarily. So I probably will talk a little bit while we're setting up. I clean my face, so the areas we're going to target and treat today are the forehead. So you'll see 1 pad being applied here, and then 1 on either side of my cheek. So I've got clean skin. I'm going to lay back and let the girls kind of take over, okay?
I'm going to prep a little bit with some alcohol too, even though you cleaned your skin. Do you mind?
No, not at all.
Just to get any excess.
And if there are questions, we've got the amazing Kellen behind the scenes being photog. So if you guys do have questions along the way, if you hear any, Kellen, just fire them off, and we certainly can answer them as well. We even have, if you guys are nervous about this technology while you're actually getting treatment, and it's a very comfortable treatment. To me, it feels just like a little bit of warmth. And then on my cheeks, you just get a little bit of muscle stimulation. On the forehead, I do have toxin in my forehead, so I have a little lighter treatment. You may not see my forehead move while we're actually treating it, but it feels like a caterpillar almost, like is sort of how I explain it to patients. Just kind of sitting on my forehead as it's actually firing the HIFES technology. But if you are nervous your first time, we do have sweet little service dogs. So Kellen, if you want to pan over, of course one of them is in the room with me.
Georgia.
Little Georgia sitting on her bucket seat having the best lunchtime ever with Mom as she gets her EMFACE technology. She's gorgeous. She wakes up like that, so she doesn't have to do any of these fun treatments.
Jealous a little bit.
So there's pads will place. It's really important that they're on clean skin, so they're removing makeup off of my face. So we want the pads to adhere uniformly, so that's why we're doing that. So you'll come in, no makeup, we'll alcohol off the face. I have got a grounding pad on, so if you take a look at my back.
Right here. Oops.
This uses monopolar radio frequency, and it actually circulates through our tissues, and so that means can't have like an artificial joint, so I can't have a hip joint or something like that while I'm getting it. But we need a place from the electricity to flow from our pads and ground somewhere, so that's my grounding pad. We put that on first.
Okay. So I'll place the forehead for Dr. Palm. So I'm not taking the sticker off yet, but we're gonna kind of just make sure we're placing it correctly. So Dr. Palm, I'm gonna have you raise your brows real quick as much as you can.
Yeah,
relax.
You can tell I'm talking.
So when you have Botox, you're not gonna visually see as much movement, right?
I'm trying.
Yeah, exactly. Do it. That means she did some good Botox.
Yeah.
All right. So I'm not placing it yet. I'm just making sure. So we just want to make sure. Obviously, it's not adhering to any hair, so not the brow area or the hairline, which this would be perfect placement. And Christy will do the same thing in the cheeks, ask her to smile, because we're just figuring out, we basically want to see where the muscles are and make sure we're placing it correctly so we can get that stimulation of the muscles in a correct placement, basically. Okay?
Yeah, and in the forehead, we're treating the forehead muscle, so the frontalis, that's our fancy name for that muscle there. You can be treated if you've had toxin, that's not a problem. Yeah. And you can go ahead and apply if you need to.
I'm going to just raise one more time for me. Perfect, relax. Alright, beautiful. So I just want to make sure this all adheres around the edges here. And we didn't get into the hairline, we didn't get into the brows. So, in my humble opinion, that's good placement.
Yeah,
just saying. Alright, we'll have Christy come place the cheeks here.
Ask you to hand that to me so I can do it from this angle over here. Oops, that is a forehead.
Oh, I'm sorry.
That's okay. I must
We
have
need
grabbed
2
two
cheeks,
for you.
yeah. There you go. I'm gonna grab another cheek.
Thank you. Alrighty. So, oops, again, we're going to sort of measure. We want to go to the corner of the mouth and up to the tragus of the ear here. So I'm going to have you smile for me. And we're treating all these muscles here to kind of give a little contouring to the jawline, hopefully, and a little lift over here. So, looking at this, looks like it's going to be a perfect placement. I'm just going to kind of put my finger on the tragus here. And go right to the corner.
Bullseye, right?
Yeah.
Mm-hmm.
You want to stay off of the little jaw there. Alright.
Grab another cheek. Let's grab another cheek here.
And there's 3 muscle groups, you know, on the forehead we were treating the frontalis, in the cheek area we're treating 3 muscles. There's 2 of them that go from the corner of our mouth up to the top of our cheekbone, and they're called our zygomaticus muscles. So the zygomaticus major and the zygomaticus minor. When we smile, they contribute to some of our crow's feet. And then there's a muscle called our risorius muscle, and that's another muscle that helps us smile. Goes from the corner of the mouth kind of into our mid cheek. So those are the 3 that we're going to be stimulating with the cheek treatment with the EMFACE.
So I'm going to do a smile for me real quick. Alright, try to relax. So we'll just do our little practice run here. Perfect. Yeah, so you don't want on the jawbone, and we want to look for this muscle here. So you want this placement kind of perfectly, just like Christy did on that side. And we're going to do our best to be very symmetrical.
And what's cool about this, maybe you can address this a little bit, is we can titrate treatments, right?
Absolutely.
Even on the forehead, even though there's one pad. So
Yeah.
what if somebody has a brow discrepancy?
So if they have a little asymmetric brow, we have little regions here on the EMFACE machine where we can turn on these regions or turn them off, so we can titrate. Say she had a little bit of an asymmetry on the brow, we can turn one off and keep the other one on and make make it a little bit more symmetric with the intensity. And same with the cheeks. If one is pulling a little bit harder, then we can go ahead and
Adjust
adjust
the settings.
the settings for that. I'm going to have Dr. Palm hold on to our little
Push button here.
This is
Yeah,
the
it's
safety
fine.
mechanism,
Yes.
so no panicking yet. That's
Exactly. We'll stay in the room with you. I'm sure too.
And like I've said, this is done as a series of 4 treatments in the 9 clinical studies that have been done on this so far. So I think there's already over 170 patients in the clinical trials. On average, we found a 19% increase in the muscle mass, an almost 30% increase in the muscle tone. And you may wonder, well, okay, if I have forehead wrinkles, why am I trying to increase the muscle mass? Well, you're trying to make that muscle like juicier and more youthful. You know, young patients, they can move that area, but it's not forming creases. And so we want to give support back to the muscle, make them younger. These muscles are attached, help have ligaments, and they attach to the bone, and these weaken, they elongate, they become more atrophic over time. So we're really trying to sort of reverse some of the aging changes we see in the musculature of the face.
So the nice thing about the EMFACE as well is that it has a little bit of radio frequency in each of the electrodes, which we will turn on now. I'm going to have you press our little button, Dr. Palm, once.
No fire there.
Did that.
And there we go. So we're going to turn up the radio frequency, and what that's going to do is help the texture and tone of the skin by inducing the production of collagen and elastin in the skin. And then we're going to start with the muscle contractions here. So we'll turn the intensity up till she can kind of feel what's going on.
Typically, the radio frequency we bring all the way up. It's very tolerable.
Yeah,
Yeah.
it just feels like
Subtle
warm, a
warmness.
gentle, nice little heat pad on my skin right now. And I don't know if you can pick this up, Kellen. So I'm starting to feel that little caterpillary feel on my forehead. We might not see that. And then I can feel a little bit of activation on my cheeks. So eventually you may see me do a little wink at you guys, do a subtle smile. And I can feel a little bit in my cheeks, so you may start to see that.
Turning it up gradually for her.
Yeah, typically with someone with Botox, neurotoxin, you'll see visually more movement within the cheeks versus the forehead. So hers, once we start seeing it a little bit more, it'll be ever so subtle because she obviously has Botox.
Yeah.
And then these will be a little more drastic, but it's going to take time as we
Feeling okay?
tighten
Yeah.
up.
Yeah, you can start seeing a little bit of a
Okay,
smile.
do you like this? It's like an awkward date.
I'm smiling.
I'm smiling, but it's awkward. Blind date face.
Right.
But it alternates, so you'll see forehead, then cheeks, then they both go together. So if you you won't see probably too much motion on my forehead, and I'll try and not move my mouth too much. I don't want to move the pads, but such a comfortable treatment. The treatment time is 20 minutes. I think the heat feels so nice. Very well tolerated. This will be treatment number 3. In the clinical studies, patients saw over a 20% increase in lift of their face. So we often will notice nice subtle changes in brow position. With the forehead treatment, we'll notice nice subtle changes along the jawline. If you're seeing that, the J word, jowls, some improvement in that. In some of the clinical study, before and afters, you could even see improvements in the nasolabial fold, because we know if we help some of those cheek muscles, that's sort of redraping part of the mid-face. So I think this is a great complement to a lot of procedures we do in the office. I think it's a great complement to some of the structural filler placement we put. To be able to now do something with muscle tone in the face. I mean, this is just really the first of its kind. So I'm very excited. I think this is in some ways complementary to sort of how we think about vectors with thread lifts. So I tend to think of this in the same way. I think that the nice advantage possibly with EMFACE is there's no downtime.
Absolutely.
I mean, this is so easy. We literally have Netflix in here. You can Netflix and chill while you're doing it.
Yeah, it's literally on.
And
You might be slightly pink afterwards.
exactly,
Right.
but that's about it.
And
And thread lifts, you're not having the benefit of toning the muscles. So I think, there's a place for thread lifts. I like thread lifts, but I think this is something that really is helping some of the rejuvenation of the deeper structures of our face.
Well, yeah, because with the radio frequency, that's huge in itself, because that helps stimulate that collagen. So we've even seen some lifting, but in some of the before and afters, texturally, kind of some changes, like a little bit with fine lines and wrinkles in the area. Obviously, we have other modalities, but with that combination with the muscles, and you're getting that kind of textural changes, the before and afters are fabulous.
Yeah. And I think, there's a difference between a young woman's face and a woman's face.
Right.
And one of those, and I tell patients this in consultation, I don't want to reverse you back to being 22, right?
Right.
We don't need moon pies. We sometimes have too much chubby cheeks. I hear that sometimes from patients. So I love the balance of light and shadow on the face.
Yes.
How light reflects off of your face and is portrayed to others is so important. And so being able to sort of re-support some of these muscles that play such an important role in how our mid-face and how our lower face and how our upper third of our face, our draping is really important. So I'm so excited. Muscle toning has really revolutionized, I think brought to a more sophisticated level how we've done
Absolutely.
non-invasive body contouring, even how I complement liposuction procedures, and really enhance results by building muscle. And now we're kind of at that point, there's so much sophistication in what we do for faces non-surgically and surgically, and now we have a way to really help with muscle tone, which is very exciting.
We did have a question if there's any contraindication with the use of Botox or Dysport.
So such a good question, and you know what, I think it has not been studied yet, so it's not a contraindication. But one thing I do tell patients, if they're on a regular sort of dosing schedule with their neuromodulator, whether it's Botox or Dysport or Jeuveau or Xeomin, and now we have Daxxify, and there's going to be more coming down the way, is maybe consider, if you're close to the end, like say you're an every 3 or 4 month person, maybe come at your basal level so that we can get the most muscle action out of that, because my muscle's still activating, but you'll see a little stronger oomph if I haven't had toxins. So my timing was horrible. Like I had done a neuromodulator like 2 weeks before we got EMFACE, and I should have like held on, but we just, the little EMFACE fairy came, and we were very happy about that, and I'm thrilled to go through treatment. So it's not been studied, a group of somebody that's had a neuromodulator, which is our fancy term for Botox, Dysport, Xeomin, Jeuveau, Daxxify, versus not having that. But my suspicion would be if you've got a little more muscular activity, maybe you'll get a little bit of an edge in the forehead treatment.
Right.
But certainly it's not a contraindication.
So maybe come right before you're due.
Yeah, and then
basically.
hold off, do your 4 weekly treatments. We can space between 2 days and 14 days. The clinical trials, it was done once a week, 4 weeks, but certainly we can, we have patients that travel in, and we can do twice a week for 2 weeks and make things a little more condensed if you're also getting ready for the neuromodulator treatment.
I've had people also ask about fillers.
So, I'm a big fan on combination treatment, but spacing those things out to get nice results over time. So I would not do it during the same treatment. I think we either, there's no absolute guidance from the company or thought leaders, but I probably would wait a couple weeks between doing a filler and doing this, just because you can have some level of swelling, even though we're involuntarily depolarizing the musculature. We are also heating the dermis, and if there is some layer of swelling, could it play some role in how the radio frequency is behaving and interfacing with the tissues? That's a possibility.
Right.
Or, if you're sort of preparing for it, doing this first, letting the muscle toning starting to happen over the next several months, and then doing the filler second is also okay.
And then same with, say, any laser procedures and or therapy, excess, and radio frequency, wait a little bit.
Again, I'm just not a big fan of doing this on same day treatment. I'm a safety girl, and I just think the more things you layer on, the more opportunities for something to go awry.
Absolutely.
So definitely using those in combination, but separating them out temporally is a good idea.
Absolutely. The other thing I like about this treatment is that it's great for, women like my age, and also women Ricky's age, where they want to maintain, their beautiful skin, and then women my age who just want to reverse things a little bit.
Prevent and maintain.
Exactly.
Yeah, so I think it hits, we get a lot of patients interested in prejuvenation in their later 20s, 30s, early 40s. I think that's fantastic, sort of getting ahead of things. There's a process called sarcopenia, and it's very analogous to osteopenia and osteoporosis that happens with bone loss. So we also experience muscle loss. So we lose somewhere between like 8 and 10% of our muscle mass every decade after 30. The same thing is happening to our facial musculature. So it's important, if we have a means of sort of rehabilitating that a little bit, I think that's important. So I think, it fits the bucket of keeping youthful faces great, but it's also so helpful, and I think our sweet spot is patients in their 40s through 60s, where we've lost some muscle tone. We're trying to rebuild that a little bit, give that pretty light and shadow back to the face, help areas, maybe we're starting to see a speed bump here, or a little bit of, shadowing in this area, or change in our brow position. These are ways that we can help it.
Are we at how are we doing with settings over here?
We're doing great. So she's at 100% on her forehead. I sort of kept it a little bit lower on her cheek so she could.
being a chatty Cathy.
Yeah, so she could talk. We're at 80% on her cheeks. So.
Yeah, and I explain to patients you feel gentle heat. The forehead, since I do have a neuromodulator, just kind of feels like a little caterpillar curling on either side. And then you can see on my face, you're not intending for your muscles to move, but they're just moving. It's not uncomfortable.
Normally when we do have somebody who hasn't had toxin on their forehead, you just see the brows lift every now and then. It's really nice, yeah.
Yeah, it's the dead giveaway that I've been touched by Botox or disorders.
That is okay. We have no judgment here.
Yeah.
I'm a little jealous.
Yeah, I know.
9 months from April.
Someday, in the future.
I'll be back shortly.
Yeah. We're anxious to see this little one. We're very
Yes.
excited about that.
Health first, of course.
But that's sort of treatment. It's straightforward. Like I said, this is my number 3 out of 4. So next week I'll finish up with my 4th results. If you look at the clinical studies, as soon as a month, I think people look great at 3. I think there's some level of maintenance we'll want. Not that we can translate body feelings to face or body findings to face, but in the body studies, without retreatment, 4 sessions of muscle toning, and it's a slightly different technology, so important to keep in mind. We still saw maintenance of muscle mass. So how do we counsel patients on terms of maintenance for EMFACE? I think we're going to recommend quarterly to semi-annually.
Yeah.
So you'll do your series of 4, and once a quarter, so meaning 4 times a year, or once every 6 months, twice a year. Do 1 to maintain.
Yeah, that's usually what I do.
And I think that's a good rule of thumb. That's kind of
Yeah.
what we recommend for fillers, once or
Absolutely.
twice a year. Doing our neuromodulator 2 or 3 times. So, you'll probably fit into one of those patterns. But really excited to have this technology. I think it's going to be such a lovely complement to so many of the minimally invasive and non-surgical treatments that we're doing, and a great way to finally target the muscle compartment, because we really didn't have a way of targeting that specifically non-surgically. So yeah, with that, just wanted to give you guys a preview. Come along with me. You can come on your
I
EMFACE
know.
journey. I'm on number 3, really excited about it. If you've got questions, you can contact us either through our website, artofskinmd.com. Give us a call. It's 858-792-7546. And we'll see you guys soon.
Bye.
And I will save it. So, thanks, honey.